Recovering from a past of violence and instability, West African economies are now threatened by the world's worst ever outbreak of Ebola. But are international travel and trade restrictions more about self-protection? This is Inside Story. Hello there and welcome to the programme. I'm Laura Kyle. It's a frightening illness which can make victims bleed from the eyes. Ebola is cloaked in misunderstanding and mistrust. The World Health Organization says the death toll from an outbreak in West Africa has passed 1,500. The number of cases could eventually exceed 20,000. Has drawn the strongest response yet from the medical charity Doctors Without Borders, which says international efforts have been chaotic and entirely inadequate to the scale of the crisis, and that self-protection is occupying the entire focus of states that have the expertise and resources to make a dramatic difference. Well, this outbreak is focused on 4 West African countries. The disease was first diagnosed in Guinea in March. The World Health Organization has confirmed 430 deaths there. It spread to neighbouring Liberia, where there have been 694 deaths, as well as Sierra Leone, where the figure stands at 422, and Nigeria, which has recorded 6 deaths. More than 40% of cases have been diagnosed within the past 3 weeks alone. Over half of all cases have proved fatal, and there's growing concern that the full extent of the problem is not yet known.
There is need for urgent action. The world has never seen an outbreak of Ebola like this. Unfortunately, not only are the numbers large, but we know that there are many more cases that have been diagnosed and reported, and that cases are increasing. I wish I didn't have to say this, but it is going to get worse before it gets better.
So plenty to talk about, and here today to do it are guests. In Nairobi, we have Ali Khansatu, an independent trader and analyst and African economy specialist. Joining us from Geneva is Michaela Serafini, Medical Director for Doctors Without Borders. And in London, we have Katie Mark, a filmmaker and journalist who's just returned from covering the Ebola outbreak in Sierra Leone. Thank you all very much for being here today. Katie, if I could start with you. You've just been on the front lines of this Ebola epidemic. Describe for us what you saw there.
Well, I was out in Kailahun, which is the epicenter of the outbreak, and I was out there with a team of people whose job it is to sort of identify people that have Ebola and help and bury the dead bodies, sort of disinfect them and bury them. And so I was going to some really remote villages, and I think one of the things that was most noticeable was just how under-resourced this effort is to try and contain it. I mean, everyone's working really hard, but we would travel up to like 8 hours a day to get to some of these villages. And by the time we got there, you know, some of the bodies might have been out for, some of the people might have been dead, for 2 or 3 days. So it's very sort of difficult to reach all these areas. And I think the other main thing that I noticed while I was out there is just how sort of under-informed people are about Ebola. Like going to these villages, there was a lot of hostility, I would say, towards these people that had come to try and help out and try and help with the sort of burying of the people with Ebola. The villagers weren't particularly friendly. They felt as if this team was coming in to sort of take their loved ones away and not allow them to have proper burials. And one of the villages I went to, the woman that had just died, she'd been dressed and cleaned up, which means that obviously her family had been handling her body after she died, which is one of the main ways that Ebola keeps spreading. So I guess it was a pretty desperate situation. I mean, a lot of people are working very hard, but it's just there's a long way to go.
And how quickly were you seeing this disease spreading throughout these villages?
Well, the day that I was with the teams, I think there were reports of each day they were kind of going to about 6. They had about 6 burials to do, and which they couldn't handle on a daily basis. But I know that there was up to, like, they said there'd be another 10 bodies that would be in the morgue in the local hospital, and they were diagnosing, or about 21 new cases were being found each day that I was there, at least. So it was quite a lot. I mean, yeah, it's spreading pretty quickly.
Yeah, Michaela, I mean, this has been called the world's worst outbreak of Ebola, and the number of cases is still accelerating. I mean, what have you noticed with Doctors Without Borders, with the people on the ground? What are the conditions that are allowing this disease to flourish?
I think that's, I mean, the conditions are all there. So obviously, it has to do with the virus itself, but also the culture. Today, as they were mentioning, burials are one of the places where the spread is the most, where the disease is spread the most, because the culture makes them treat bodies in such a way that the contact with them makes it extremely feasible to afterwards be infected with Ebola. Second thing has to do with migration. This is I mean, Liberia, Sierra Leone, Guinea, and the places where today the epidemic are in their epicenter are places that are moving all around. So obviously, one person that starts to be symptomatic goes to another place and gets in contact with other people, and a new focus is created over there. And the other thing that makes it extremely important has to do with, today you were saying in March the first case. The first case was detected back in December 2013 in Guinea. And unfortunately, there was no really attempts to really address that on time so as to avoid the spread. The more cases, the more contacts, the more contacts, the more cases. And that starts to be really an increase of cases and deaths that goes just day after day in a quite thorough.
Katie, we've been hearing that the health systems in these countries have also broken down, and I think you alluded to it earlier. There's a great fear amongst people in these countries. There do seem to be some very simple ways to prevent catching Ebola, such as washing hands, such as not touching infected people. Why are the populations not listening to the authorities, not listening to the doctors, and adhering to those measures?
From what I can tell, to talking to people, I think it's sort of a fear of the unknown. First of all, something like washing hands with soap is a really basic thing, but also actually in some of these places, soap and water aren't that as accessible as, you know, if out here. And then the other thing is just fear, because people haven't seen this and people don't know what it is, and so they're not really. You know, like there was one place I was in, and the team, Red Cross team, went out and they said, this woman, she's probably died of Ebola, and the villagers say, I don't think she has. You know, people die here all the time. Why do you say, you know, now it's Ebola? So there's a lot of sort of just misinformation about it. And then there's also the issue of, I think, sort of traditional African superstitions, which I think is also hindering kind of the spread of knowledge, the spread of like what you need to do about this disease, because people say it's, you know, like juju, which is like a sort of black magic, and people don't really understand what's happening. So I think that one of the reasons is just sort of a lack of knowledge. And
do they trust the doctors there, the health system that's in place?
I mean, the health system was already crumbling. It was not a good health system to begin with, you know, and so it's just, this has impacted an already really weakened health system. And the doctors there don't know really how to deal with it. I think the doctors that are helping MSF and sort of foreign doctors, and I think for a lot of people, that's also, you know, you see people come in, like maybe some of these villages have never seen white people, and then suddenly they're coming in and people are getting sick, and maybe they're taking away people to help them, but what they see is they're taking away people, and these people are never coming back. So one man said to us, you know, that his sister went to the hospital and she just didn't come back. And then there was a rumor around the village that if they get taken away, they're not going to come back. They don't understand that it's sort of like, you know, that this is the best way to deal with Ebola, is to try and get help as quickly as possible. So people aren't getting help as quickly as possible. They see it just as a death sentence, and so they aren't reporting it.
Michaela, how are your doctors with your organisation? How are they tackling this fear towards white faces, white doctors, Western medical systems?
There are certain measures that, even though completely, I mean, we are almost invisible. Oh, the suits are taking all our body. We are not identified anymore. But still, there are simple measures like the eye contact that we try to do, even though with goggles, even though with the whole suit. It's just whenever a patient is coming into our isolation, it's just that eye contact that you might have with that person, spending the appropriate time, because we also cannot spend a full day. I mean, we can spend just 45 minutes inside an isolation unit, and then we have to go back because either it's too hot, etc. But during those 45 minutes is try to really pay attention to the need of the patient we have in front. Even though there's not much on treatment we can do today, there are minimum measures that we can do that, in a way, tries to bring a little bit closer the patient to the doctor and try to humanize a little bit this situation that's completely distant.
Ali Khan, this has been called a disease, Ebola has been called a disease of poverty. Would you agree with that it's a disease mainly afflicting poor people, and with that, the lack of education that they have?
I think that's probably true, and I think that explains the risks attached to Ebola, the fact that it wasn't damped down much earlier on. It sort of stayed below the radar before popping big in the last 4 to 6 weeks. None of these countries have health services to speak of. They simply don't have the tools in order to make a serious intervention. So I think that's quite correct. And if you look, Laura, at these 3 countries, we're talking about a combined GDP which is half of Afghanistan. But as you're reporting in the news, next door we have the elephant in the room, which is Nigeria, $500 billion GDP. If that catches an infection, of course, we're going to have a massive consequence on the African economy below the Sahara.
Well, let's look a little bit more now at the economic impact. And most of the affected countries and their neighbours have closed their borders to stop the virus spreading. This has killed off what was vibrant trade in commodities such as palm oil. In the last 2 days, Air France and British Airways suspended flights to the region, and that's a move that the UN says makes it harder to tackle the virus and hurts these economies. Sierra Leone had hoped to export $200 million worth of diamonds this year, but the government says the outbreak will prevent it from meeting that target, with miners afraid to go into diamond pits in the country's east where Ebola is present. This week, the African Development Bank donated $60 million towards essential supplies to help train medical workers. But it says the outbreak could cost the affected countries up to 4% of their gross domestic product. A massive hit for countries that are already very poor.
Foreign exchange levels are down. Markets are not functioning. Airlines are not coming in. Projects have been cancelled. Business people have left. That is very, very damaging. Now, add to that the fact that this is rainy season and people are not farming. So prices are going up, price of produce, at a time when purchasing power is limited. You are increasing poverty.
Ali Khan, that's a pretty bleak picture being painted there. I mean, Ebola has already taken its toll, really taken its toll on these countries economically, hasn't it?
Absolutely. I think, we've come to a standstill in many of these countries who are, remember, emerging from civil wars. In 2 of the countries' cases, there was a lot of optimism coming out, but they've hardly got any buffers at all. I was looking through, for example, Laura, the Treasury bill rates, which is how much the government has got to pay to borrow money. In all these countries, you've seen a big shift higher in the cost of borrowing, so you can already see the pressure building. And I think, Donald Kaberuka, very apocalyptic, I admit, but I think what he was doing was showing that there is a very urgent need. And I think that $60 million, if it's dispersed quickly, will have a big impact. These are small countries, small economies, right at the frontier of the frontier. They just don't have the capacity or the pockets, in my opinion. I think there's a massive undercount going on. His statistics are notoriously difficult in sub-Saharan Africa. I think these numbers are undercounting it. I think the surveillance system has not got 100% capture. When I looked at the recent report coming out of WHO talking about 20,000, You know, we know viruses are linear, are non-linear, exponential. I could predict 200,000, and I think my prediction would be more valid than the WHO prediction is at this moment in time. Massive economic risk, obviously so far contained to a degree, but we live in an interconnected world. Many of our African cities are optimal breeding grounds for this kind of disease to spread. I think we're way behind the curve, and I'm really worried about the impact that's going to, you know, beyond these 3 and 4 countries. I'm worried it could spread. Look at the way the diasporas have spread all over the world. We've got linkages which did not exist before, and this virus is already making its way out of this very small area.
Michaela, is it fear of this spread of Ebola that has dictated the rich countries' response to it? I mean, we're seeing a degree of self-protectionism, aren't we? Rather than countries reaching out to help West Africa, they're sort of closing their borders and pulling back.
I think there's quite a protectionism. It's the response to a natural disaster like the one we had in Philippines and the one we had in Haiti had a completely different resource and time response than the one that we're seeing today with Ebola. Ebola started back in March, and since today we are still asking exactly the same thing. We need people, we need coordination, we need action, we need really people that are on the ground helping us to try to at least contain, and I don't say stop at this moment, but at least contain this epidemic, and we are still not having that answer.
Katie, when we see these countries sealing their borders, when we see flights stopping going to places like Sierra Leone, what message do you think it sends to people there?
I think actually it just propels, sort of fuels the fear, because yeah, you have to. I mean, what they've said is you have to isolate, of course, people that have it, but closing borders and stopping flights, it's just saying, you know, this whole country's sick, basically, and we shouldn't be doing anything with it. And just sort of on the micro level of the sort of economic impact on these countries, from what I saw, like I would talk to a farmer who had a friend that was diagnosed with Ebola, and all his farm, everyone that worked on his farm didn't want to come and work on the farm anymore because they didn't want to handle money in case, you know, someone that had Ebola had touched that money, or you know, going through like 20 checkpoints from Freetown to Calhoun meant that like a lot of basic necessities aren't getting through to these more remote areas. And we went past one sort of village, I guess, where they said they'd run out of salt completely. They hadn't had any salt, and you know, for like the past 2 weeks they hadn't had any salt. So just, I mean, just on the mic, just on everyday things, you could see how that was already having like a huge economic you know, effect on people.
And Ali Khan, I mean, you know, Katie touched on the agriculture side of things here. Of course, agriculture is a huge part of these economies. And we've got Sierra Leone agricultural minister saying that its economy is deflated by some 30%. I mean, a huge number of its people are farmers. Of course, roadblocks are crucial to containing the disease, but how far do you go before it also risks sparking widespread food shortages?
Absolutely, and you know, these are very agri-dependent economies. There are a lot of villages where people are basically subsistence farming, and if you get a big breakdown in that, and you get higher food prices reverberating through these already stricken economies, I think it's going to add tons of complexity and complications for the governments as well. Just to divert a little bit, you'll remember that there was an intervention in a slum in Monrovia, I think, and as they quarantined it, food prices within this place that was quarantined spiked 300%. And I'm surprised there wasn't much more unrest. So we got lots of risks now at play. I'm just not confident at this moment in time. I look at the Western world, I look at the equipment that people are being met with when they come off flights, I look at the equipment in our airports, and you know, we're talking about the Stone Ages here. It's quite extraordinary, and that sort of thing is really what concerns me. And in these fragile economies, of course, if the food markets stop operating, stop functioning, we've got a very, very serious problem.
And Michaela, when you see these flights stopping flying to the countries, how does that impact your work? I mean, it must prevent a lot of people, a lot of doctors reaching these countries. It must prevent a lot of aid getting in.
Completely right. Today we are really struggling with trying to deploy our volunteers working over there. So we need to do, but we need to find, the flexibility that we had before is not there, even though we need much more people over there. So it has affected us quite a lot.
And how do you think it's going to get worse? I mean, we've got people suggesting that there's going to be a large number of cases emerging. Do you think that's going to be accompanied by a greater geographical spread, Michaela?
I hope not. Today, what I can say is that we are behind this epidemic. We don't reach to stop it. We just reach to contain certain areas. We still have a long way to go. This is not 1 month, 2 months. People are speaking about 6-9 months projection. So I think we still have a long way to go.
Ali Khan, we saw Nigeria having a lot more success in limiting the spread. Only 6 cases, as opposed to hundreds in the other countries. What is it about Nigeria that has managed to be successful?
I think, they were bolder in their approach, more aggressive in isolating the cases. And I think, they've tried to deal with it's at an earlier stage in Nigeria than it is in its neighbors. And they're trying to snuff it out at this point. But, when I look at a city like Lagos, 20 million people living cheek by jowl, I can't help feeling that, this is, the situation in Nigeria has the potential to tip a lot worse. And I think, we might be in a sort of air pocket where everybody's patting Nigeria on the back before a real surge in the situation. I mean, I don't think we've gone parabolic on this Ebola curve. And this is the nature of viruses. They hit a parabolic moment. And if it goes parabolic somewhere like Nigeria, I think it's going to be extremely difficult to bring under control.
Katie, we're seeing yet another conference of West African health ministers. I believe it's being held in Ghana today. Are you hopeful from what you've seen on the ground that these countries are going to get this spread under control?
I think, like Michaela said, they started off very slowly, but I think now the full impact of what is happening has been realised, and they're all taking it very seriously. I mean, even in Sierra Leone, making it legal to hide someone that has Ebola. I mean, that's a pretty desperate move, but it just shows it's just one example of taking it seriously. And Nigeria has promised, I think, 1.9 billion naira, which I'm not sure what that is in pounds or dollars, but to try and help contain Ebola. So I think now they can see that it's serious, and they're now ready to take it seriously. I hope, anyway.
OK. And Michaela, just in the last minute that we have, it's thought that it will take 6 months or more to get under control. Is that a time frame that you agree with?
I think it's optimistic still.
OK. Ali Khan, by the time this disease has got under control, what do you think the full economic impact on West Africa is likely to be?
Well, it's going to be a magnitude of what it is now. And I think that's why Kabaruka was so apocalyptic in his words, because he could see that if we're talking 6 months, these economies will be contracting if they're not already contracting. And therefore, it needs an urgent dose of, I think, money, resources, and, a very determined push in order to bring this under control. I remain extremely concerned. I remember reading a comment by Joshua Rosenberg, who says that the virus presents the greatest risk to humankind. I think in Africa, we're talking about a very asymmetric landscape. We can't access all these places. This is the perfect breeding ground for such a situation. And I think, the world has to now come and support these fragile countries, put money to work, put resources to work, and beat this back. Because, if this spreads much further, the whole Africa Rising story is going to have the legs cut from underneath it, I think.
And I'm afraid on that very bleak note, we do have to end our discussion today. But thanks very much to all our guests for joining us here on Inside Story. Ali Khan Sachu in Nairobi, Michaela Serafini in Geneva, and Katie Mark in London. And thanks very much to you two for watching. You can let us know your thoughts by leaving your comments on facebook.com/AJ Inside Story, or go to @AJ Inside Story on Twitter. I'm Laura Kyle. From me and the whole team here, bye for now.